Rub this oil on your skin. Every night, here is really happens to pain, inflammation. Before I delve into the truly remarkable insights I have for you tonight, I urge you to pause for a moment and give this your full attention. The information I am about to impart has fundamentally reshaped my entire perspective on managing chronic pain, the visible signs of skin aging, and the pervasive issue of inflammation within the body. Let me be completely frank with you. I dedicated more than 2 decades of my life to the practice of medicine before I genuinely grasped the profound simplicity and efficacy of what I'm about to reveal. In medical school, aspiring doctors are readily equipped with prescription pads designed for dispensing pharmaceuticals. What they don't teach you, what isn't handed to you, is this powerful, often overlooked knowledge. This is precisely the kind of groundbreaking truth that the pharmaceutical industry would prefer not to see gaining widespread attention or becoming a viral sensation on platforms like YouTube. Yet, the evidence is compelling. A single, natural oil, when consistently massaged directly onto your skin each night before bed, possesses an incredible ability to deeply penetrate your bodily tissues. It can effectively quiet your immune system's overactive fire alarm, reducing the constant cellular distress, and astonishingly, even work to rebuild the very architecture of your collagen. In many documented instances, this simple nightly ritual has been shown to reduce chronic joint pain by more than half, offering significant and tangible relief. This isn't mere anecdotal evidence or some theoretical concept. These are practical, tangible results, backed by rigorous, peer-reviewed scientific studies. These investigations have been meticulously conducted at highly respected institutions globally, including the esteemed University of Manchester, Stanford's pioneering Department of Dermatology, and the crucial National Institute on Aging. Indeed, a particularly significant and landmark study, published as recently as 2021 in the reputable journal Aging and Disease, delivered truly astounding findings. It revealed that the consistent topical application of specific, carefully selected plant-derived oils led to a remarkable reduction in key biomarkers of systemic inflammation. These markers, such as C-reactive protein, CRP, and interleukin-6, IL-6, are commonly used indicators of inflammation throughout the body. The study showed a reduction of up to an astonishing 47% in adults over the age of 65, achieved after merely 8 weeks of diligent nightly application. Think about that figure, 47%. This incredible outcome wasn't achieved through ingesting a dietary supplement, nor did it involve complex surgical procedures. It was simply the result of applying a natural oil directly to the skin each evening before sleep. Now, here's precisely why I genuinely hope you'll continue watching and stay with me throughout this entire presentation, because the oil that holds the coveted #1 spot on tonight's transformative list, identified as the single most powerful and impactful oil of them all, is something truly astonishing. It's an ingredient that a vast majority of people likely already have readily available, sitting right in their kitchen cupboards at this very moment, yet they have probably never once considered applying it to their body for these profound benefits. I will reveal this surprising oil to you in just a few minutes, and I assure you, its identity will undoubtedly take you by surprise. But before we delve deeper into our countdown, I want to ask you something genuinely personal, something that will help me connect with your experience. Please take a moment to drop your current age in the comments section below, whether you find yourself at 60, 70, 80, or even gracefully beyond those years. And crucially, tell me, where do you consistently experience the most pain or persistent stiffness in your body? Is it a nagging ache in your knees, a persistent discomfort in your lower back, or perhaps a stiffness in your hands first thing in the morning? I personally make it a point to read every single comment posted on this channel. Each one, your unique experiences and answers, will directly help me to create even more relevant content and beneficial videos tailored specifically for our community, for people like you. So tonight, we embark on an exciting journey, counting down from number 5 all the way to the highly anticipated number 1. We will explore the 5 most remarkably powerful oils that you can incorporate into your nightly routine, gently massaging them onto your skin. This isn't just a list, it's a carefully curated selection, ranked from those that are impressively effective to those that are absolutely extraordinary in their capabilities. Each of these oils operates through a unique mechanism, targeting specific pathways within the body and interacting in distinct ways that are particularly beneficial for the aging body. This nuanced understanding is crucial, and it's precisely what so much generic health content unfortunately misses entirely. The simple truth is, a body at 70 years old does not and cannot respond to treatments in the same manner as a body at 35. This physiological difference is key. In fact, after the age of 65, your skin's natural absorption rate for lipid-soluble compounds, essentially fat-based substances, actually increases quite significantly. This occurs because the skin barrier, a protective outer layer, naturally becomes somewhat thinner and more permeable over time. What this means in practice is that these beneficial oils can penetrate your skin far more efficiently and deeply than they did when you were younger. This isn't a drawback or a sign of decline. On the contrary, it represents a remarkable biological opportunity, a natural advantage that you are, unfortunately, not commonly encouraged or even told how to leverage. Let's waste no more time and begin our countdown. Coming in strong at number 5 and already proving itself to be far more powerful and beneficial than most people currently realize is black seed oil. This remarkable oil is meticulously pressed from the tiny, potent seeds of Nigella sativa, a plant with an astonishing history. Its medicinal use has been documented and cherished for over 3,000 years, revered across ancient civilizations for its healing properties. While its ancient wisdom is undeniable, what modern science has meticulously uncovered about its profound effects in just the last decade is genuinely breathtaking and undeniably remarkable. The principal active compound responsible for black seed oil's incredible benefits is known as thymoquinone. I want you to envision thymoquinone not just as a general anti-inflammatory agent, but rather as a highly skilled and exceptionally precise fire brigade. When inflammation, that unwelcome guest, decides to set up a troublesome camp within your joints, your muscles, or your crucial connective tissues, thymoquinone doesn't merely haphazardly douse the entire area with water, as many conventional anti-inflammatory medications tend to do, often with broader side effects. Instead, it precisely targets and deactivates specific inflammatory messengers within your body. These are compounds known as prostaglandins and leukotrienes. By quieting this inflammatory cascade directly at its very source, thymoquinone effectively calms the cellular turmoil without indiscriminately disrupting the normal, essential functions of your overall immune system, making it a very intelligent approach. A compelling study, meticulously conducted at King Abdulaziz University, provided robust evidence for this. Researchers closely monitored 60 patients all over the age of 65 who were suffering from debilitating chronic knee osteoarthritis, a condition that significantly impacts quality of life. The group of participants who consistently applied black seed oil topically twice daily over a period of just 4 weeks reported an astonishing 40% reduction in their pain scores. This stands in stark contrast to the mere 14% reduction observed in the placebo group, who received no active treatment. This means that the black seed oil provided nearly 3 times the level of pain relief. It's particularly significant to note that these individuals were not newly experiencing pain. They were people who had endured and lived with this persistent, often agonizing pain for many years, making the rapid and substantial relief even more profound. For aging bodies, in particular, the significance of black seed oil cannot be overstated, largely due to its interaction with a phenomenon known as anabolic resistance. This is a genuinely frustrating and common reality of the aging process, where your body's inherent ability to efficiently repair and regenerate tissue after periods of inflammation or injury gradually diminishes. The remarkable thymoquinone found in black seed oil has been scientifically demonstrated to downregulate the NF-κB pathway. You can think of this pathway as the body's central internal loudspeaker, amplifying and broadcasting signals of inflammation throughout your system. By effectively quieting this loudspeaker, thymoquinone allows the body's natural and crucial repair processes to finally take over and initiate healing once the acute inflammatory phase has successfully calmed down. When it comes to application, it's vital to choose cold-pressed, unrefined black seed oil. A simple rule of thumb: the darker the color and the more pungent, almost peppery, the aroma, the higher the quality and potency, indicating a richer concentration of beneficial compounds. To apply, warm approximately a teaspoon of the oil between your palms, allowing it to become more pliable. Then, gently but firmly, massage it into your most painful joints, perhaps your knees, elbows, or wrists, for a focused period of 3 to 5 minutes, using consistent circular pressure. Make this a ritual every single night, ideally about 30 minutes before you plan to go to bed, ensuring your skin is clean and slightly damp. The subtle moisture on your skin is key here, as it helps to gently open the skin's channels, dramatically improving how deeply and effectively the oil is absorbed into the underlying tissues. For an incredibly powerful synergistic effect, consider pairing your black seed oil application with a few drops of frankincense essential oil. It's crucial to remember that frankincense essential oil should always be properly diluted, never applied neat or on its own directly to the skin. The boswellic acids present in frankincense act upon a completely different inflammatory pathway within the body, specifically the 5-LOX pathway. This means that when used together, black seed oil and frankincense simultaneously attack inflammation from two distinct angles, creating a truly comprehensive anti-inflammatory strategy. Imagine it as strategically blocking both possible exits for the inflammatory process. And speaking of precisely blocking inflammation at its very source, our number 4 oil takes this powerful concept even further, and what it specifically accomplishes for the delicate aging nervous system is something I personally find truly astonishing. Moving forward to number 4 on our highly impactful list, we find rosehip seed oil. Before we delve deeper into its remarkable capabilities, I want to ensure absolute clarity. It's vital to understand that this is not the same as rose oil, which is distilled from rose petals and has different properties. Nor is it simply a rosehip extract encapsulated as an oral supplement. What we are discussing is the pure, cold-pressed oil meticulously extracted from the tiny seeds found inside the vibrant fruit of the Rosa canina plant. This precious oil contains arguably one of the most profoundly regenerative compound profiles of any topically applied oil known to exist, making it a true powerhouse for skin health and beyond. Rosehip seed oil is exceptionally rich in several key beneficial components. It boasts an extraordinary concentration of trans-retinoic acid, which is a naturally occurring plant-derived form of vitamin A, a powerful ingredient renowned for its skin-renewing properties. Additionally, it is abundant in linoleic acid and a unique, rare fatty acid aptly named Rosa AF. Researchers at the University of Santiago in Chile specifically identified Rosa AF for its potent anti-inflammatory and exceptional skin regeneration properties, marking it as a significant discovery. A rigorous clinical study published in the esteemed journal Clinical Interventions in Aging provided compelling evidence of its efficacy. Patients who consistently applied rosehip seed oil to their face and neck areas twice daily for a period of 8 weeks experienced truly impressive improvements, a remarkable 43% enhancement in overall skin hydration, a significant 45% reduction in skin roughness, and a measurable, visible decrease in the depth of their expression lines, all when compared to a control group who did not use the oil. These results underscore its incredible potential for skin rejuvenation and health. However, here is the absolutely crucial aspect that almost all conventional beauty-focused channels completely overlook, and it's precisely why rose hip seed oil truly belongs in a vital health conversation, rather than being confined solely to the realm of cosmetics. As we gracefully advance in years, particularly after the age of 70, a significant biological shift occurs. Your skin's natural production of ceramides, those essential lipid molecules that function like the mortar holding the bricks of your skin cells together, forming a robust protective wall, declines by a substantial margin, nearly 30%. When this crucial mortar diminishes, your skin fundamentally loses its vital barrier function. This compromise means that environmental toxins, harmful bacteria, and common allergens find a much easier pathway to penetrate inward, potentially causing irritation and damage. Beyond that, a compromised skin barrier means your skin itself can become a chronic source of low-grade systemic inflammation, incessantly sending out subtle distress signals that, over time, accelerate the aging process throughout your entire body. The incredible news is that rose hip seed oil actively works to restore this critical ceramide barrier. By diligently rebuilding and fortifying this protective layer, it significantly reduces the inflammatory burden that your body might otherwise be carrying around silently 24 hours a day. I recall a particularly impactful patient, a wonderful woman named Dorothy. She was 74 years old, a retired school teacher from the charming city of Baton Rouge, Louisiana. Dorothy initially came to my office troubled by persistent skin sensitivity and a constant low-level ache in her arms and shoulders, a discomfort that had defied explanation from numerous other medical professionals. After 12 weeks of consistent nightly application of rose hip oil, thoroughly massaged onto her full arms, shoulders, and décolletage, Dorothy returned to my office. Her face alight, she told me the aching had diminished by what she conservatively estimated was about 60%. Furthermore, her inflammatory markers had measurably and significantly shifted. Her C-reactive protein, CRP, level, a key indicator of systemic inflammation, plummeted from 4.2 to an impressive 1.9. While rose hip oil wasn't the sole change Dorothy integrated into her routine, it was, by her own account, the most consistent and impactful one she made during that period, contributing greatly to her improved well-being. For optimal application, start by dispensing 2 to 3 drops of rose hip seed oil per targeted area, warming it gently between your palms first. Then, crucial for aging skin, massage the oil upward, always working against gravity. This upward motion is particularly important after the age of 60, as you are intentionally working with skin that has already endured decades of the natural downward pull of gravity. This mindful technique helps to gently lift and support the skin. For an enhanced synergistic effect, I recommend adding a single drop of vitamin E oil to your rose hip application. Vitamin E is a powerful, fat-soluble antioxidant that plays a vital role in stabilizing the delicate and beneficial fatty acids present in rose hip oil, preventing them from oxidizing on your skin's surface before they have a chance to be fully absorbed. This simple addition effectively doubles the potency and efficacy of your nightly application, ensuring you get the maximum benefit. Now, if you are finding this information as genuinely valuable and enlightening as I believe it is, I want to take a brief moment to ask for a small favor. Please take just 1 second right now to hit that like button. This seemingly small action sends a powerful signal to YouTube's algorithm, instructing it to share this crucial information with countless other seniors and individuals who desperately need to hear these insights tonight. And if you haven't already, please consider subscribing to this channel. I am committed to releasing new science-backed health videos every single week, specifically for this incredible community. and I truly wouldn't want you to miss out on the transformative content that is yet to come. With that, let's continue our journey, because number 3 on our list is where things become truly, profoundly fascinating. Coming in at number 3 on our compelling list is magnesium oil, and the very moment I refer to it as an oil, I need to immediately clarify a critically important distinction. Technically speaking, magnesium oil is not an oil in the conventional sense at all. Rather, it is a highly concentrated, supersaturated solution of magnesium chloride dissolved in water, which upon contact with the skin simply feels oily to the touch. This nuanced distinction is incredibly significant, particularly because magnesium chloride, when delivered in this transdermal form, meaning through the skin, completely bypasses your entire digestive system. This is one of the most vital pieces of information for anyone over the age of 60 seeking effective mineral supplementation. Here lies a frequently overlooked problem with traditional oral magnesium supplements, a challenge almost no one openly discusses. After the age of 65, your body's natural production of stomach acid decreases by a considerable margin, roughly 40% compared to what it was when you were 30 years old. This reduction in stomach acid directly translates to dramatically lower absorption rates of essential minerals from your gut, and magnesium is unfortunately one of the primary minerals affected. Research studies consistently indicate that many older adults absorb less than 30% of the magnesium contained in an oral supplement before it simply passes through their system, offering minimal benefit. However, when you apply magnesium chloride directly onto the skin, it is efficiently absorbed through the tiny hair follicles and sweat glands, making its way into the bloodstream and local tissues within a remarkably short period of 20 to 30 minutes. Researchers at the prestigious Magnesium Research Institute in the Netherlands have even estimated these transdermal absorption rates to be significantly superior for localized tissue delivery, especially when compared to oral intake. So why is this method of magnesium delivery so profoundly important and impactful when it comes to addressing pain and inflammation within your body? The answer lies in magnesium's absolutely fundamental role. It acts as a crucial cofactor in over 300 enzymatic reactions that are constantly occurring throughout the human body, facilitating countless biological processes. Among its most critical and directly relevant roles is its ability to modulate a specific receptor within your nervous system, known as the NMDA receptor. I want you to conceptualize this receptor as a highly sensitive volume knob specifically designed for pain signals. When your body's magnesium levels are sufficient and adequate, this NMDA receptor is partially blocked, effectively keeping those pain signals at a much more manageable and tolerable level. However, when magnesium is depleted, which astonishingly is the case in an estimated 68% of adults over the age of 65, that crucial pain volume knob gets turned all the way up, leading to heightened pain perception. In my extensive clinical experience, chronic pain that appears to be disproportionate to any clear injury or physical damage is very frequently a deeply rooted magnesium deficiency problem, essentially wearing a pain costume. Further underscoring this point, a significant study conducted at the University of North Carolina revealed compelling results. It found that consistent transdermal magnesium application, used 5 times weekly over a period of 12 weeks, led to a substantial 35% reduction in fibromyalgia pain scores among participants. Furthermore, it resulted in a measurable and clinically significant improvement in sleep architecture for postmenopausal women. And let me remind you the crucial role of sleep. It is precisely during those hours of rest that your body undertakes its most vital repair and regeneration processes. Therefore, any intervention that effectively improves the quality and restorative nature of your sleep is, in and of itself, a powerful anti-aging and anti-inflammatory intervention working to restore your body from the inside out. For effective application of magnesium oil, target areas where absorption is typically good and where you experience discomfort. I recommend applying it generously to the soles of your feet, a highly porous area, your inner forearms, and most importantly, directly onto any specific painful joint or muscle area before you settle down for bed. Aim for approximately 10 to 15 sprays of a 31% magnesium chloride solution per application area. This potent solution is widely available and can be easily sourced at most reputable health food stores or conveniently purchased online. When you first start using it, you might experience a slight tingling sensation on your skin, particularly during the initial week or so. This is completely normal and, interestingly, is actually considered a common indicator of magnesium deficiency within the local tissue. As your body's magnesium levels become replenished and your tissues become replete, you will typically find that this tingling sensation gradually diminishes, confirming your body is integrating the magnesium. For truly exceptional synergy and to maximize the benefits of multiple oils, here's a powerful technique. Apply your magnesium oil first. Allow approximately 10 minutes for partial absorption into the skin. Then, and only then, follow up with your chosen rose, hipseed oil, or black seed oil on top of the same area. The reason for this specific order is fascinating. The magnesium works its magic by relaxing the tiny, smooth muscles that surround the hair follicles in your skin. This relaxation effectively widens the microscopic channels and pathways through which the subsequent oil can then travel. In essence, by applying magnesium first, you are consciously creating a biological welcome mat, making your skin significantly more receptive and permeable, thus allowing the second oil to penetrate far more deeply and efficiently, amplifying its therapeutic effects. Now, we move to number 2 on this exceptional list, an oil that consistently surprises nearly every patient and colleague with whom I've discussed it. This is also the very oil I subtly hinted at and teased right at the beginning of this video, promising something truly remarkable. Yet, we are still saving the absolute #1 position for something even more extraordinary, an oil so incredibly well-studied, so profoundly multi-mechanistic in its action, and so perfectly tailored and suited to the specific needs of the aging body, that I genuinely consider it one of the most overlooked and tragically underutilized longevity tools available to us today, all without the need for a prescription. But first, at number 2, we have emu oil. And before any initial reactions or preconceived notions might set in, I implore you to stay with me and keep an open mind, because the rigorous scientific evidence supporting its benefits is legitimately impressive, and the research institutions involved in its study are far from being small or obscure names. Emu oil is derived and rendered from the natural fat of the Australian emu bird, and what makes it truly unique is its extraordinary fatty acid composition. This composition is unusually similar to the natural lipids found in human skin. It consists of roughly 70% unsaturated fatty acids with a particularly high content of oleic acid. This profound structural similarity to human skin fat is precisely the reason why emu oil possesses an unparalleled ability to penetrate the skin barrier far more deeply and rapidly than almost any other oil known, and indeed even surpasses the penetration capabilities of many pharmaceutical topical carriers designed for drug delivery. It's truly a marvel of natural science. Further research conducted by esteemed researchers at the Boston University School of Medicine produced compelling results, demonstrating that emu oil possesses an extraordinary capacity to effectively carry other beneficial compounds right through the skin barrier and deep into the underlying tissues, reaching depths that many other conventional topical carriers simply couldn't achieve. But its utility extends far beyond just being a superior carrier. Emu oil itself is is inherently and profoundly biologically active. A study published in the reputable journal Skin Pharmacology and Physiology discovered that emu oil significantly reduced skin inflammation in an animal model by a statistically significant margin. Subsequent human studies further corroborated these findings, showing measurable and visible reductions in redness, swelling, and localized pain at the sites where the oil was applied, providing tangible relief. Perhaps even more strikingly, a clinical trial conducted at the University of Queensland yielded impressive results for those suffering from joint discomfort. Patients who regularly applied emu oil to their arthritic joints reported a remarkable 42% greater reduction in pain compared to those who used a conventional anti-inflammatory cream. This difference is substantial and speaks volumes about emu oil's efficacy. Now, here's precisely why this particular oil holds such critical relevance for aging bodies. After the age of 75, your body experiences a significant decline in its dermal collagen, losing approximately 35% compared to its levels at age 30. This isn't merely a superficial cosmetic concern affecting skin appearance. Collagen is the fundamental structural scaffolding that provides integrity and support to your joints, your tendons, and even the vital walls of your blood vessels. The exciting news is that emu oil has been scientifically shown to stimulate fibroblast activity. Fibroblasts are the critical cells within your body that are directly responsible for producing collagen. In vitro studies conducted at Flinders University in Australia demonstrated an increase in collagen production by up to 20% in aged skin tissue when treated with emu oil. Additionally, emu oil naturally contains terpenes, which are powerful plant-like compounds that have independently demonstrated significant anti-inflammatory activity at the fundamental cellular level, adding another layer to its therapeutic profile. I want to share a deeply touching story about a remarkable gentleman named Robert. He was 78 years old, a retired electrician from the charming city of Knoxville, Tennessee. For a grueling 11 years, Robert had been grappling with severe, debilitating hand pain, the kind of persistent discomfort that insidiously steals away the joy and meaning from the activities that once enriched your life. He could no longer indulge in his beloved pastime of fishing, nor could he find satisfaction in working on his intricate woodworking projects, hobbies that once defined a significant part of his identity. His devoted daughter, recognizing his struggle, brought him to a seminar where I was speaking, and he thoughtfully approached me afterward. I introduced him to the concept of emu oil and strongly suggested he apply it diligently to both of his hands every single night before retiring to bed, emphasizing a thorough massage for 5 full minutes, carefully working the oil between each knuckle and along every tendon line. Just 6 weeks later, I received a truly heartwarming call at my office. It was Robert, his voice filled with an unmistakable sense of accomplishment and renewed spirit. He excitedly informed me that he had not only completed a birdhouse, but he had proudly built it for his beloved grandson. After more than a decade of hands that had felt as fragile and painful as broken glass, Robert had once again found the capacity to create something tangible and meaningful with his own hands. This story powerfully illustrates the transformative potential. When you apply emu oil in the evening, dedicate a genuine 5 to 10 minutes to thorough massage rather than just a superficial surface application. The goal is to truly get the oil deep into the tissue, working it diligently around joint capsules, into the muscle belly, and along the tendon lines. For an exceptional synergistic boost, consider adding 2 to 3 drops of copaiba oil to your emu oil before you begin the application. Copaiba is extraordinarily rich in beta-caryophyllene, a unique compound that actively engages and activates your body's own endocannabinoid system, specifically targeting the CB2 receptors found in your immune cells. This targeted activation further reduces local inflammation without any associated psychoactive effects. The sophisticated combination of emu oil's unparalleled penetration depth and copaiba's precise receptor level activity represents one of the most elegant and effective topical anti-inflammatory strategies that I know of. And now, the moment you've been patiently waiting for, the revelation I promised you right at the very beginning of this video, our #1 most powerful, most scientifically validated, and most surprisingly accessible oil on this entire transformative list. I can almost guarantee you that when I reveal its identity, your immediate first reaction might very well be, "I already have that in my kitchen," or "I've always had that," followed by a profound thought of, "Why on earth did nobody ever tell me about this before?" The answer, at long last, for our top spot is none other than extra virgin olive oil, but specifically, it needs to be cold pressed from an early harvest and possessing a high polyphenol content, diligently applied directly to your skin every single night. I understand completely if you were anticipating something far more exotic, perhaps an obscure oil with a complex, unpronounceable name sourced from a remote rainforest. However, I urge you to set those expectations aside and truly hear me out, because the scientific evidence supporting extra virgin olive oil as an incredibly potent topical anti-inflammatory and anti-aging agent is remarkably even more robust and extensive than for almost anything else we've discussed on this list, and its underlying mechanism of action is truly extraordinary. High-quality extra virgin olive oil contains a unique and powerful compound called oleocanthal. This remarkable molecule was discovered by insightful researchers at the Monell Chemical Senses Center, and what makes it so incredible is that it functions as a natural plant-derived ibuprofen at a fundamental molecular level. Oleocanthal effectively inhibits the very same enzymes, COX-1 and COX-2, that conventional pharmaceutical anti-inflammatory drugs specifically target. It achieves this through an identical inhibitory mechanism, but crucially, it does so via a natural molecular pathway, demonstrating nature's profound intelligence. A groundbreaking study published in the prestigious journal Nature revealed a truly fascinating insight. A mere 50 milliliters of high polyphenol olive oil contains an anti-inflammatory effect equivalent to approximately 10% of a standard adult ibuprofen dose. Now, at first glance, that percentage might sound somewhat modest. However, its true power becomes abundantly clear when you grasp the fundamental difference in its application. You are not ingesting this. Instead, you are applying it directly to the specific tissue where you need targeted relief, completely bypassing the complex digestive system and the liver's metabolic processing. Furthermore, you are doing this consistently, every single night, for months on end, not just occasionally. The real magic, the profound impact, lies in this cumulative and targeted effect. Beyond the powerful oleocanthal, extra virgin olive oil is also abundantly rich in squalene, a remarkable compound that your skin naturally produces in generous quantities when you are younger, but which unfortunately declines quite sharply after the age of 50. Squalene plays a vital role in forming a delicate yet highly protective antioxidant film directly on the surface of your skin. This film acts as a shield, effectively neutralizing harmful free radicals before they can cause oxidative damage to your precious skin cells. It also serves to deeply lubricate the deeper dermal layers, contributing to skin suppleness. Moreover, studies conducted at the University of Granada have shown that topical application of squalene can even help to reduce the risk of skin cancer in sun-exposed populations. Additionally, the significant oleic acid content within olive oil works to actively restructure and fortify the lipid layers in your skin barrier. This directly combats the problematic transepidermal water loss, TEL, a major factor that dramatically ages your skin and significantly contributes to the chronic inflammatory burden we discussed earlier, making your skin stronger and more resilient from within. Now let's explore what makes this particularly extraordinary and perfectly suited for older bodies. As we age, specifically after 65, a subtle but significant shift occurs within our cells. Our mitochondria, those tiny crucial power plants residing inside virtually every single cell in our body, responsible for energy production, begin to produce an increased amount of reactive oxygen species, ROS. You can visualize these as being akin to cellular exhaust fumes, highly damaging byproducts that unfortunately cause DNA damage and relentlessly accelerate the aging process at the most fundamental and deepest biological level. The incredibly potent polyphenols found in high-quality, extra virgin olive oil, specifically compounds like hydroxytyrosol and tyrosol, have been scientifically proven in research from the prestigious University of Athens to directly scavenge and neutralize these harmful reactive oxygen species within skin cells following topical application. This crucial action effectively protects the delicate mitochondrial DNA from the insidious oxidative damage that is a primary driver of accelerated aging. Furthermore, a large and compelling observational study published in the American Journal of Clinical Nutrition, which meticulously followed over 1,200 women over the age of 65, yielded truly remarkable insights. It found that those women who exhibited the highest skin surface concentrations of olive oil polyphenols, as precisely measured through skin biopsies, displayed significantly lower rates of deep wrinkle formation. They also boasted higher collagen density and presented lower dermal inflammatory markers compared to their peers. It's vital to understand that these impressive differences weren't necessarily attributed to the women consuming more olive oil in their diet. Rather, the profound distinctions were clearly linked to their consistent topical application habits, highlighting the direct power of this simple external ritual. For complete transparency and to empower you with verifiable knowledge, all of the scientific references and studies I have meticulously cited tonight are thoroughly listed and readily available in the full description located directly below this video. I strongly encourage you to go and meticulously review them. I genuinely want you to verify every single claim and piece of information I have shared. Moreover, I want you to feel confident enough to take this knowledge and discuss it openly with your doctor. My intention is for this information to be a valuable part of an informed conversation with your healthcare provider, not to serve as a replacement for professional medical advice. For optimal application, it is absolutely essential to use a high polyphenol extra virgin olive oil. When selecting your oil, look specifically for terms like early harvest on the label. This crucial detail indicates that the olives were pressed before their peak ripeness, precisely when their beneficial polyphenol content is at its absolute highest. A high-quality oil of this caliber should possess a distinctly slightly peppery, almost pleasantly bitter taste if you were to sample it. That characteristic bite or peppery sensation you taste is actually the powerful oleocanthal at work, and it's your definitive assurance that you have found the genuine article. Each evening, ideally after your shower when your skin is warm and receptive, or simply before you go to bed, measure out about 2 generous tablespoons of this extraordinary oil. Warm it gently between your palms, then apply it generously to your legs, arms, torso, hands, and any specific areas where you experience chronic pain or notice visible signs of skin aging. Take your time to massage it in slowly and mindfully, always working against gravity, for a minimum of 5 dedicated minutes. Don't worry about your skin feeling excessively greasy. That's not the goal. If applied to slightly damp skin, the majority of the oil will absorb beautifully within 15 to 20 minutes, leaving your skin nourished and supple, not slick. For the most extraordinarily powerful synergistic effect you can achieve with any combination on this entire list, I highly recommend combining your nightly olive oil application with a preparatory 30-minute soak or foot bath containing dissolved magnesium chloride flakes beforehand. This magnesium pre-treatment acts as a gentle yet effective mechanism to open up the skin pathways, making it much more receptive. Subsequently, the olive oil then penetrates with extraordinary efficiency, carrying its potent polyphenols and the remarkable oleocanthal even deeper into the targeted tissues. Researchers who specialize in transdermal drug delivery have a specific term for this kind of intelligent dual application approach. They call it priming and loading. It fundamentally and dramatically changes how effective the second compound, in this case the olive oil, can truly be. If your primary concern is to specifically target arthritic hands, a concern so many of you in this wonderful community have thoughtfully mentioned in the comments section, here's a bespoke treatment. In a small glass bowl, carefully mix 2 tablespoons of high polyphenol olive oil with 4 drops of copaiba oil, 2 drops of frankincense essential oil, and a teaspoon of magnesium oil. Gently warm this mixture. It's absolutely crucial to never use a microwave for this, as excessive heat can unfortunately destroy the delicate polyphenols. Once warmed, immerse your hands in this soothing mixture for a dedicated 10 minutes. This is an ideal time to relax, perhaps while watching television or listening to something calming before bed. Commit to doing this 4 nights a week and allow a full 8 weeks before you begin to fully judge the profound results. Remember, consistency is the entire game when it comes to these natural interventions. These oils are not quick fix pharmaceutical drugs. They work cumulatively, building architecturally within your body, much in the same way that good, wholesome nutrition works its wonders, not instantaneously overnight, but profoundly and sustainably over an extended period of time, leading to lasting transformation. Now, as we bring our journey to a close tonight, I want to leave you with a message that I believe holds just as much, if not more, significance than any of the scientific data or specific recommendations I've shared. I have spent a substantial career in medicine, witnessing firsthand the profound and often devastating impact that chronic pain and the visible signs of aging can have on a person's entire sense of self, their identity, and their joy. I have sat across from countless patients, their eyes filled with quiet resignation, who stopped attending cherished family dinners because the persistent ache in their knees became simply too unbearable. I have observed individuals gradually give up on beloved passions, whether it was gardening, dancing, or the adventurous spirit of traveling, not because they fundamentally lacked the desire for these enriching experiences, but because their own bodies had ceased to feel like willing partners and instead had become frustrating, formidable obstacles. So many of these individuals had been implicitly or sometimes explicitly told that this gradual decline was simply the unavoidable reality of aging, the predetermined trajectory of later life, and that there was nothing particularly interesting or effective that could genuinely be done to alter it. I stand before you tonight to emphatically state I do not believe that. I have never for one moment believed that. And the robust science and practical insights I have shared with you tonight represent a small yet profoundly genuine piece of compelling evidence that there are indeed accessible tools available to you right now. These aren't hidden secrets. They are readily found in your local health food stores, often sitting right in your own kitchen, or easily procurable online for less than $20. These are natural resources that your body can actually learn to utilize, to actively fight back against decline, to diligently rebuild, and to effectively quiet the persistent inflammation that may currently be stealing your precious sleep, limiting your cherished mobility, and diminishing your overall joy. You are absolutely not too old for your skin to respond positively. You are not too old for your aching joints to finally experience some much-needed relief. You are fundamentally not too old to make a powerful decision that tonight is the pivotal night you choose to start treating your body with the profound respect it deserves as the truly remarkable, resiliently adaptable, and still incredibly capable organism it actually is. Whether you find yourself at the age of 62 or 84, please know this with unwavering certainty. Your biology has not given up on you. My deepest hope is that tonight's discussion has provided you with a powerful, compelling reason to stop giving up on it yourself. If this video has resonated with you, if it has offered you value or a glimmer of hope in any meaningful way, I earnestly ask you to please subscribe to this channel right now. Don't forget to hit the notification bell so you won't miss a single future video that could potentially transform your well-being. And finally, I encourage you to go to the comment section below and share 2 things with me: your current age and which of these 5 powerful oils you are most excited to try first. post. I am personally committed to reading every single response you share. This incredible community is the very heart and soul of why I dedicate myself to making these videos. And your unique stories, like those of Dorothy and Robert, are the invaluable insights that I carry with me into every consultation, every lecture I deliver, and every script I meticulously write. The comprehensive scientific references are all clearly laid out in the description for your review. The oils themselves are readily available to you. The only thing truly left to do is to begin.